Ito lamang Sabado, May 21 ay inanunsyo ng Department of Health ang unang kaso ng Omicron sa variant BA.4 sa Pilipinas at kasalukuyan rin mino-monitor ngayon at pinag-aaralan ng mga eksperto ang sitwasyon ng long COVID cases sa ating bansa. Ating pong alamin ang iba pang detalye patungkol dyan. Kasama po natin si infectious diseases expert na si Dr. Ronchin Solante. Magandang umaga po, Doc.
Good morning, Yusek Rocky.
Opo, Doc Ronchit, ito pong Omicron na sa variant BA.2.12.1 ay nakapagtala po ng 17 cases sa ating bansa. 16 dito po ay tama po ba, locally acquired. May panibagong update po ba patungkol sa variant na ito?
So far, Yusek Rocky, we're dependent on the result of the Philippine Genome Center. And for now, I think they don't have yet updates on whether our cases for the BA 2.1, 2.1 has increased, and that's what we're trying to wait, especially for a slight increase in the cases for the past 2 to 3 days. But I don't see this a significant increase, but it's important to monitor because these are also important way of telling us if this variant of concern or the lineage of your Omicron, which is more transmissible than the parent Omicron, will be the cause of the local transmission or community transmission.
Opo. Doc Ronchin, ito lamang Sabado nakapagtala ng unang kaso ng COVID-19 Omicron sa variant na BA.4 sa ating bansa. May iba pa po ba kayong impormasyon patungkol dito sa Pilipino pong nagpositibo dito sa BA.4 maliban po sa siya po ay nanggaling sa Middle East?
So far, the information about this infected or with the BA.4 is really limited. And going back to this BA.4, this is also another lineage of the Omicron that is being seen as responsible for the spike in surge of cases in South Africa and in Portugal. And rightly so that we need to monitor also, since we now have both of these lineages of the Omicron more transmissible, and the other aspect of these lineages, it can also evade immunity from the vaccines that we have received, especially for those who have been given the vaccine 4 to 6 months ago and without booster, including that of those who were previously infected with that Omicron variant of concern. This is not an assurance that you will still be protected with this BA.4. So we need to closely monitor if in the next few days or few weeks if there will be cases, increase in the cases.
Opo. Pero sa ngayon po, bukod doon sa mga nabanggit nyo, may panibagong update po ba dito sa BA.4? May mga nadagdag po bang naitalang kaso o wala naman po na? Sana wala na po.
Yes, I think none yet has been reported, but we need to wait, because we know how our surveillance is doing, and it's not real time, and we need to wait for further information. Hopefully within this week they can also have a follow-up on the result of the sequencing of other positive individuals, but I'm hoping it will not be causing an increase in the cases.
Opo. Doc Ronchin, bakit daw po tinuturing na variant of concern itong BA.4 kumpara po sa ibang variant ng Omicron na variant of interest lang? Ito rin po yung tanong sa inyo ni Lay Alves ng GMA News, at isa pa po niyang tanong, ano raw po yung katangian nito at gaano ito kabilis makapanghawa?
Okay, so if we look at Omicron as the parent virus, BA2, so let's take it look first. BA2 is 20 to 30% transmissible over the parent Omicron variant of concern. So you have that selective advantage that it can be easily transmitted from one person to the other. So that's one factor why it was considered a variant of concern. Now, you have BA4, which among the data coming from South Africa and Portugal, that it has a growth advantage of at least 13 to 14%. So what does this mean? This is more transmissible compared to the BA2. And in fact, in just a few weeks, cases has surged in these two countries. And more or less, although BA2 is still the dominant variant of concern, but it is being predicted, but by the way, the rate of the increase in cases among the population infected with BA4 in these two countries, they are predicting that the BA4 will be, and BA4 and BA5 will be the next dominant variant of concern. And because of that, easily spread and rapidly spreading, these are the main reason why it is a variant of concern. And the other factor, Yusek Raki, even if you're infected before with an Omicron, even if you were vaccinated, fully vaccinated, you are not exempted. You can still get this infection. So another factor to make this variant of concern category.
Kaya dapat talaga, Doc Rogit, sobrang pag-iingat pa rin. Ano? Sunod pong tanong ni Lay Alvis, ano daw po yung mga dapat gawin para maiwasan ang surge dala ng mga bagong Omicron na subvariants?
Okay, so the presence of these lineages or subvariants is not for us to panic, no? It's for us to be ready always with our protocol, with our way of preventing it to be transmitted easily. Okay, the more we have to reinforce our health protocol by wearing the face mask, especially in poorly ventilated areas, being able to get the booster vaccine for the general public, and increase the uptake of second booster for the healthcare workers, for the immunocompromised, and for the 60 years old and above. So it's not to panic. We need to strengthen our measures on how we cannot transmit this and how we cannot expect surge and spike of cases.
Opo. Pero Doc Ronchid, nakikita niyo po ba yung posibilidad na maging dahilan itong BA.4 na mabilis na pagtaas muli ng kaso ng COVID-19 sa ating bansa?
Well, personally, it is a possibility, because in countries like South Africa and Portugal, where vaccination is also high, but the booster uptake is low, because of a waning immunity, this is where higher breakthrough infection, so we call that breakthrough infection, meaning after being fully vaccinated, you can still get the infection because your immunity has waned. And chances are a majority of our population are still having the fully vaccinated series, but there are already percentage of our population in which immunity has waned because we are not getting the booster dose.
Opo, nabanggit po kanina sa aming interview ni Secretary Joey Concepcion na kung tumaas man daw po yung mga kaso at hindi naman po makakaapekto sa ating hospitalization rate, sana daw po ay wag nang magbago itong ating mga alert level. So sa tingin ninyo, sakali lang po na talagang tumaas din yung kaso ng sa bansa dahil sa BA.4, ano po ang nakikita niyong epekto nito sa hospital utilization rate sa ating bansa?
Okay, based on the limited data, this variant has not been observed to cause more severe infection. No? So that's a good news, no? Because you may just have mild infection and you can still just isolate yourself, and you don't need to be brought to the hospital. So in a way, we can spare the hospitalization part. But Yusek Raki, if cases are going up, there's also always a possibility that some of these patients will really be going to the hospital. No? Mm-hmm. And that's what we are trying to monitor. As long as our hospitalization rate is stable, hospitals can still accommodate even if there will be hospitalized or those with severe cases. I don't see the need that we will increase or we will enhance our alert level. No? But again, monitoring is very important now since we now have two of these lineages that is considered to be highly transmissible and can also evade vaccine protection.
Opo, nabanggit nyo na epektibo pa rin po yung bakuna ng mga nakakuha ng booster shot laban dito sa BA.4. Pero pwede nyo po bang irekomenda na magpa-second booster shot na dahil dito? At paano naman po kaya itong primary vaccine lang yung nakuha?
Okay, that's a very good question. No? So how we go about it? So the question is, are the general population enough reason to be given a second booster because of these variants of concern? For now, there's no data to tell us that the general population will benefit with the second booster. That's why monitoring those vaccinated and also boosted, and if we have more cases of fully vaccinated already and getting the booster also, the first booster, and yet getting the infection, then there's more reason to believe that most likely a second booster is needed in order to maintain that wall of immunity for the general population. So since we don't have that data yet, it's important to observe and monitor the cases and emphasize the importance of a second booster for the vulnerable population.
Opo. Doc Ronjin, may tanong po yung ating kasamahan sa media. Tanong po sa inyo ni Rafael Busano ng ABS-CBN. Alin daw po sa dalawa ang mas transmissible, itong monkeypox or SARS-CoV-2? Dapat daw po bang mangamba ang publiko sa monkeypox at gaano kalaki ang tsansa makapasok ito sa ating bansa?
Okay, in terms of transmissibility, it's still the COVID that is more transmissible because of several ways of transmission. Aside from the droplet, you can also have airborne because of a very small particle. It can remain in the air, and when you will be exposed, then that's another way. And there is also contact transmission. For the monkeypox, the most common human-to-human route of transmission or mode of transmission is only respiratory droplets. So meaning within 3 feet, talking to each other without any face mask. That's the mode of transmission. Now, on the aspect of a possibility that it can be present in our country, yes, it will. No, it is a possibility because even in some countries where the healthcare facilities, the ability to diagnose is really very high tech, and the infection was still documented. No, with travel, you know now the possibility of one infection carrying a person carrying the infection can also travel a lot and can also enter a country. That's where the vulnerability of most of our population, when one has the infection, incubating and then arrive in the Philippines and develop the symptoms upon arrival or upon after the arrival.
Opo, Doc Ronchit, follow-up lang po ni Jenna Balaoro ng GMA News. Sa pagpasok daw po ng BA.4 dito sa bansa, di ba na kung irerekomenda niyo na po ang border restriction sa Pilipinas?
So far, it's too early to implement a border restriction. Even in countries where BA.4 and 5 is already increasing, they don't implement border restrictions. What's important here is to really monitor, and I think we still need to encourage the testing for those who are vulnerable population, so that we have to target the vulnerable population having the symptoms so that we can intervene because of treatment. And I don't see any problem with the general population as long as we are wearing our face masks, we are following the health protocols.
Opo. Ayon po kay Dr. Ted Herbosa, kasalukuyang minomonitor ang kaso ng long COVID sa ating bansa. Ano po itong long COVID at ano usually nararamdamang sintomas sa mga nakakaranas daw po nitong long COVID?
Okay, long COVID is now an accepted diagnosis, as part of the complications of COVID-19. It usually occurs after patient has fully recovered but still had symptoms like difficulty of breathing, difficulty of the recall, so memory problem, and then there are also some element of easy fatigability, or some have on and off cough. So usually long COVID is considered a complication of COVID-19, and there are specific population that when you have long COVID, there are also complications in the heart and the pulmonary organ, and sometimes they can be readmitted again because of these complications. And that's why it's important that part of our work in the ground is monitoring those who have these symptoms, because follow-up with doctors is important to prevent such complications of the heart and the lungs.
Opo. Doc Ronjit, pero ano daw po yung pwede nyo imungkahi na sa tingin ninyo maaring gawin po ng ating pamahalaan para naman po masolusyonan itong merong long COVID cases situation sa ating bansa?
Okay, aside from increasing the rate of vaccination, because vaccines can also prevent long COVID. So meaning if you have COVID and you were vaccinated, data from UK is important that your risk of getting long COVID is lower if you were vaccinated compared to unvaccinated. But I think the more important part here is consider long COVID as part of a complication that most hospitals should ready to address. Okay, ready to address in terms of prevention of more complications as a result of long COVID, and that entails also regular follow-up with the doctors.
Doc Ronjin, kami po ay nagpapasalamat sa inyong pagsama sa amin at pagbibigay ng mga mahalagang impormasyon. Doc Ronjin Solante, maraming salamat po.